Harleen de Gras didn't hesitate to get the shingles or flu shot, but she's not keen to be one of the first to get the Pfizer-BioNTech vaccine.
They've had some reactions to the drug that they weren't expecting in England, so that makes me a little leery.
The two UK healthcare workers have a history of severe allergies and carried EpiPens.
Now that we've had this experience in the vulnerable populations, the groups who've been selected as a priority, we get that advice to the field immediately.
That advice for people with severe allergies? Hold off on getting vaccinated. For now, Canadians are being told to hold off only if they are allergic to one of the vaccine's components. The vaccine program starts with one shot. A second dose comes 21 days later. The protection kicks in about a week later.
Cole Pino, good morning.
In an interview with CBC Radio's The Current, the head of Pfizer Canada says the main side effects are expected with the first dose.
There's going to be a little bit of pain on injection, some soreness, maybe some mild temperature, maybe a headache, but that's very common with all vaccines.
Common because they're signs of an activated immune system, but an overactivated immune system is potentially deadly. It's an allergic response to a specific ingredient in the vaccine, and that actually makes predicting risk difficult.
So those who have even reactions to one type are not actually at an increased risk to react to another if it's an allergy, because the components differ so widely.
Still, the risk of severe allergic reaction to vaccines is rare, about 1 in a million.
Our rollout is a little bit after theirs, so we're going to have all that information, and we're going to be able to incorporate that into helping our patients and helping them make the right decisions.
And hopefully getting on with lives that have been stuck in park for so long. Vic Adopia, CBC News, Toronto.
Okay, now I got to bring in infectious diseases specialist Dr. Zain Chagla on this, because Dr. Chagla, I'm one of those people. I've got an EpiPen. I've got severe allergies. And here I am wondering if it's possible that getting vaccinated might be dangerous for me. So what would my options be if that turns out to be true?
So there's a few options. One is, there is probably a component in this vaccine that's triggering the response if this is a true issue. And so once it's identified, theoretically, if the Moderna vaccine comes around, doesn't have that component, that may be an option. If they have a shared component, then perhaps one of the novel vaccinations down the road. And again, if it's serious and urgent, once the compound is developed, you can try to test with skin testing. There's graded challenges. There's ways we can try to get people, even that are allergic, vaccinated, as long as we kind of get a sense of what's leading to the reaction more than anything else.
Right. There's a controlled way to do it, but also other alternatives, I guess, in some of the other vaccines potentially.
Yeah, exactly. And again, by the time this sorts out, by the time the general population is really invited to get vaccinated, I think we'll have a better sense of what's leading to this, and again, what the alternative options are.
Dr. Chagla, very good to talk to you. Thank you.
No problem.